and not hurt healthy tissue. And all 5 lesions are in remission now.
That's great.
And he's fully functional. So historically, melanoma was thought to be radio-resistant. There were a group of cancers. Radio-resistant means it does not respond to radiation. But actually, with radiosurgery, when you focus a beam and you give a higher dose per fraction and fewer treatments, you get as few as 5 treatments, the success rate is about 90%.
Wow.
So we're seeing a lot of skin cancers this week. We saw another man who's hopefully listening. He had also fair-complected, blue-eyed, brought in his daughter as blonde and blue-eyed. Everyone in his family is blonde and blue-eyed. And had a very, very extensive skin cancer on the right forehead going into the hairline. Had a biopsy showing a squamous cancer, which is a very common kind of skin cancer. The surgeon put an incision right down the middle of this cancer. The cancer, if you imagine, is almost the size of your palm.
Wow, that's a big cancer.
Yeah, it's big. And I don't know, I guess the surgeon was trying to resect it. I don't know where to get the skin to fix that hole, because it'd be a big hole left behind.
Yeah.
And so he had surgery, it didn't work, and he came to us this week, and he chose to proceed with focused beam radiation, like radiosurgery, so we're focusing on the cancer, and hyperthermia. Mm-hmm. So he's read about hyperthermia. Hyperthermia has been used since Cleopatra's days. Hyperthermia means heat.
Right.
And if you heat the cancer, the heat produces heat shock proteins, and it helps kill the cancer. So using heat, which is totally painless, non-invasive treatment, and radiation together to try to make this cancer go away. So I started treatment on Thursday. The hyperthermia is 1 hour. So you have to heat for 1 hour to get to about 43 degrees Celsius. The local area is a little bit hot. His wife and daughter were there. And came back Friday. He was doing great. So we're going to do hyperthermia twice a week and the radiation every day, and hope to watch this cancer go away.
It's great that he's doing better.
Yeah, he's doing better. We're going to go to our commercial break. We have great sponsors. I always say the voice is fantastic, but it's true. And then we'll be back with more cases. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York.
News Talk Radio 710 WOR.
At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES. 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Yeah, we're back. That's right. We're at WOR. How do people find us, Rob?
So if listeners would like to call in, our number here is 1-800-321-0710. Again, that's 1-800-321-0710.
Rob, do you notice we walked in the studio and everyone's talking about Robin Quivers? Do you know who she is?
She's Howard Stern's sidekick, right?
Right. So you've been watching her for since your puberty years?
I have seen her many times in the past.
Really, I might have to speak to your mother about that. So tell me, what's the news? Why is everyone talking about her in the studio today?
Well, because she's cured, right? Is what she says.
Well, what did she have?
So I'm not sure if she had endometrial cancer or bladder cancer, different things.
Well, USA Today, which the staff here at WR have on the computer, so they feel a kinship with her for good reason. USA Today says she's cancer-free after a 15-month battle with disease in her uterus, and Howard Stern was quoted as saying, "I thought she was a goner." So they say he's indelicate. She's 61 years old. She's been broadcasting the show from home. She had chemo, radiation, and surgery for endometrial cancer, USA Today said.
Okay.
So what's endometrial cancer?
So it's a cancer of basically the endometrium, which is like the lining, right?
Right. So every month when a woman has menstruation, she's losing that lining. That's what menstruation's all about. So every month she has a new lining in her uterus, and the lining is getting prepared for pregnancy, really. I mean, the whole process of the uterus and menstruation is to have a fresh lining that's got lots of nutrition and blood supply for a little impregnated egg to implant and grow and become a little baby and then a big adult like you and me.
Right.
So she had a cancer in the endometrium. What are the usual signs of endometrial cancer?
I'm going to guess vaginal bleeding.
Yeah,
right.
Vaginal bleeding. So usually women who have vaginal bleeding that's not normal, that's not part of the normal menstrual cycle, is a warning sign. Mm-hmm. So if you have bleeding that's not timely or too much or excessive, or you've been through menopause 10 years ago and you're having bleeding again, it's something that it's a warning sign. You need to go see your gynecologist about it, and you should go ASAP.
Right.
So in the article, they're talking about, someone said, well, she's cured. Her doctor said she's cured. Now, what does cure mean?
So cured, when you're cured, generally, that means you have no real chance of the disease coming back, right?
So cure means free. It's gone. It's never going to come back. It's never, ever going to come back.
Right.
So she's 15 months out. She just was at home broadcasting. So what do you think 15 months after being diagnosed with endometrial cancer? Would you say you're cured?
I would say you're in remission.
Yeah, you're in remission. So there's two kinds of remission. Mm-hmm. There's a complete remission and a partial remission.
Right.
So what's the difference between a complete remission and a partial remission?
So correct me if I'm mistaken. In a partial remission, right, you just have a decrease in basically the tumor signs and the symptoms.
So let's say you had the 5-centimeter tumor and it went down to 1-centimeter tumor. That's remission, partial remission.
Right. And the threshold, I think, is like 50%. As you know,
people use different numbers, but that's a fair thing to say. Now, what is a complete remission?
0%. So now you have no signs of the tumor.
Right. So there's no visible signs of tumor. So probably she really has a complete remission. And how does a complete remission differ from a cure?
It can come back.
Right.
You're not safe, so to speak.
Now, there was a study actually done in one of the cancer journals that said the word, cure is a word that most doctors don't use.
Sure.
Because we don't like it. It's like, why don't airplane companies say, we didn't have any crashes this year, right? Like airplane safety is the highest safety level in the last 100 years, right?
Right.
But United Airlines doesn't have an ad. We didn't have any crashes last year.
Right.
Why do they do that? Why do they have no ad saying we don't have any crashes last year?
Because it would be misleading. Right?
Well, no, it's not misleading. I don't think it's misleading. It's true. They didn't have any crashes last year, but it's kind of like asking for trouble.
Right. Okay.
You know what? Okay. So they didn't have any crashes last year, and what happens the next day if, God forbid, they have a crash? Wow.
Right.
They're kind of leading people to believe, well, last year was great. It's almost bringing on their own bad luck.
Sure.
So a prudent doctor would almost never say a patient is cured.
Yeah.
And a prudent doctor, I think I'm a prudent doctor. People ask me, well, will I be cured? How do you know I'm cured? Well, you have to die of something else, right?
Right.
So if you have, I don't know what, the X cancer, and doc, how I know I'm cured? Well, you die of a jealous lover, or you die making love when you're 120 years old, or, something like that. But you don't want to bring on the bad spirits.
Definitely.
And you don't want to say things before, because then you could be proven wrong, and no one wants to be proven wrong. So this article about Robin Quivers, when they talk about cure, I think what they really mean is she's in probable complete remission. We're not her doctor. I'm not her doctor, and I imagine you're not her doctor.
I'm not her doctor.
So we're only talking from a news article and all the staff at WOR, and they're so excited that she's doing well, and we're happy for her, if this article is correct, that she's doing well, and we wish that she lives to be 120 years old.
That's right.
So that's endometrial cancer. There's another article about women's health concerns, breast cancer. Some people say we don't talk enough about it, but I try every week to talk about important issues for men and women, and we're all related. We all have mothers, wives, girlfriends, boyfriends, fathers, brothers, so we're all related to some degree, and some shows have more of one than another, and I try to balance things out. We've been dealing with a lot of women who have breast cancers and breast lumps that have not been diagnosed. They have lumps that are growing, and they stay home, and we're trying to tell them, please come and get diagnosed and treated. The earlier you get diagnosed, the better it is.
Yeah.
So we want you to get diagnosed early. Come in. It's easy to get diagnosed. We're going to have a special show in a few weeks just on breast cancer and breast cancer imaging, so stay tuned for that, and we'll tell you about the expert who's coming on the show. But a new study looked at breast cancer in black women and white women. And in black women, life is 3 years shorter for black women who have breast cancer compared to white women. And the reason is mainly because the cancer is more advanced when they're diagnosed.
Okay.
So, again, it means that black people are getting less health care, like in prostate cancer. Prostate cancer mortality for men is 200% higher. So we're seeing something similar in black women. And this was reported in the Journal of the American Medical Association, which you talked about just a few minutes ago. And it said that a significant number of black women get inferior cancer care. But overall, the main problem is that black women get less health care overall, and that screening and early detection may have failed to reach the black communities in good numbers. So what's screening and evaluation? What's that? How is that for breast cancer? What do you do to screen and diagnose breast cancer?
So for screening, you generally get imaging, mammography, right?
But actually, the majority of breast cancers are self-diagnosed. Women find a lump themselves. Because women know the breast better than the doctor, better than anyone else. They feel a lump. That lump doesn't belong there. The lump has to be evaluated. And when you have a lump that's new, you cannot go to the doctor and the doctor says, oh, that's nothing. It doesn't work that way. Because if you have a lump, you have a lump.
Sure.
And it has to be evaluated. And usually the best evaluation would be a mammogram or an ultrasound and sticking a little needle in that lump. It's not painful. You numb up the skin, put a little needle in, suck out some cells, and make a diagnosis.
Yeah.
So you cannot reassure someone, say, oh, your lump is nothing, don't worry about it. That's the wrong advice. And actually, unfortunately, missing breast cancer is very high risk for doctors and radiologists. It's one of the number one causes of lawsuit in the medical world. White women live 3 years longer than black women with breast cancer, and it's not because they get different care. It's mainly because Black women are not getting screened, and they're not coming for medical care. So the real important issue here is examine your own breasts, get mammograms, see the doctor, and we're trying to close this gap between black and white. There should be no difference. And also, black women are twice as likely never to receive treatment. So 12% of black women with breast cancer never get treatment.